So no one wants to say the words, I'm gonna say it now, vagina, period, uterus, pain, bleeding. These are like taboo words in society. So even if they're going to school, they're having very painful periods. They're afraid of soaking through their clothing. Some guardians, parents, caregivers either take it as this is a part of life, this is not okay.
Welcome to the Visionary Network show, where I interview entrepreneurs, creative, and professionals from different industries who are making a tremendous amount of impact and are high performers. Today's episode, we're going to have Dr. Jalinthia Trotman. We're going to be talking about what is it like breaking into medicine, being a woman of color in the space, and also what it's like to create a business, not only educating, but also being able to inspire the next generation when it comes to their physical and mental health. So stay tuned, take some notes, and again, don't forget to like, subscribe, and share. One of the things that I always like asking physicians is, where did it all start for you? The interest in science and medicine.
So I've always been a science girly, like that's just my thing. But the medicine parts really started in Trinidad. So that's where my grandma's from. And visiting one year, I think it was about 12 or 13 years old. And I read the newspaper where young girls, 16, 17, were having babies and they were dying. And there was a lot of maternal mortality just around things that are supposedly natural. So at the age of 12 or 13, I decided I'm going to be a doctor and I'm going to take care of young women who's pregnant.
Okay. The path you went isn't easy.
I think the path is truly meant that very few of us actually make it, especially coming from a community where I had no one to really guide me. So the first thing was just my conviction. I surrounded myself by people who really had a similar goal. My friends, even in high school, we all had the same goal of doing something, whether someone wanted to be a lawyer or someone wanted to be something else. So I just knew I would do it.
Where does that drive come from?
It definitely comes from my family. I think it's just been instilled in us that we do the work. So I've always seen women in my life who's just been workers and accomplishing things. My father as well. So I come from a family where they're just hard workers. They came to this country and they decided they were going to do what's best to make sure that their children accomplish more. So that drive just comes from them.
I love that. At what point did you realize that you wanted a special in pediatric and adolescents gynecology?
So my path to medicine led me to women's health. I rotated at Kings County Hospital in the middle of Flatbush. And I really fell in love with the adolescents, with teenagers. At that point, I saw myself in these young girls who were coming in and they had a lot of questions, a lot of concerns, a lot of fear, a lot of secrecy around things that were either quite normal or they truly needed help. And there was so much delay in them either seeking help or coming in and something was so simple that I'm like, this is not even a problem. We'll take care of this in no time flat. So both them and their parents or their grandparents or their loved ones, I just saw that their life just changed from one or two visits. So looking at younger girls, I really fell in love with that to say, hey, and plus I'm having a good time. Like we're in the room, we're talking, we're vibing. This is not even that serious. And when it is serious, they're leaving feeling more confident. So then I decided, okay, let me take care of adolescents in a way. But the field of pediatric gynecology was not even one that I knew existed at that time. I started residency on the labor floor, delivering babies, liking everything, but not really falling in love. As a second-year resident, during one of my rotations in high-risk OB, I became almost depressed because I thought to myself, hey, this is what I wanted to do. Why am I not loving it? I want to deliver babies. And I met with a mentor, and she says, well, Jill, what do you like? Like, what about GYN really makes you tick? And I said, well, it's really speaking to people. And in medical school, I really liked talking to teens and decided as a second-year resident of 4 years, this is what I'm going to do. So I set my path on that and I pursued specialty training for adolescent gynecology.
So, now that you're an expert in this space, many people in our audience are working professionals, successful, very busy, but also raising children.
Yeah.
And so when you think about that dynamic, what are some common things you see within adolescents today? And what are some best practices, if any?
So one of the most common issues really is issues of the menstrual period. So this is very heavy, very painful menstrual periods. So even if they're going to school, they're having very painful periods. They're not able to pay attention in classes. They're having to go to the nurse's office. They're afraid of soaking through their clothing. So they're either afraid to go to school or they're in the bathroom, they're missing out on good opportunities. They're not able to participate in some activities, after-school activities. There's a lot of stress, a lot of tension. And with that, I do have some young people who become depressed. Some guardians, parents, caregivers either take it as this is a part of life, maybe staying home from school a couple days out of the month is routine, but it's really not. Or some are just so worried and thinking that there really isn't options for them. They just have to live through it. So being able to meet families and say, hey, this is not okay, right? This is not normal. I know it's common, but it doesn't mean it's okay. Let's do sometimes simple steps, or let's get you prepared, or actually let's take it to the next step. We're able to see a lot of young people then kind of get their life back. Sometimes it's two totally different people between the first visit and the second or third visit. So
Is there a specific age that people should be looking out, for parents to be looking out for this sign? Can we be proactive in certain situations rather than have to have, their child experience that pain for prolonged periods? What are some things to be looking for?
absolutely. And I think that's my life's work. So one of the first things is before the menstrual period even starts. So if you're the biological mom, you have your own menstrual history. So some parents may have suffered or struggled through heavy menstrual periods or painful menstrual periods and had that road. So if you're that person, the minute your child starts going through puberty with breast development, you almost want to start that discussion with the pediatrician. The discussion starts before you get to the office. By the time you come to the office, you should have known, well, how often is the menstrual period happening, right? You're giving them a calendar. You're also making the discussion open. So no one wants to say the words, I'm going to say it now, vagina, period, uterus, pain, bleeding. These are like taboo words in society. So you want to really take that taboo out of it, right? Like how heavy is your menstrual periods? Doesn't matter if dad's around, brother's around. Like these are conversations that we should have that's open. So that's one of the first things I want families to know. Like be proactive, understand what is happening. And then the second part is this okay? So where you get the information from. So seeking out good resources usually starts from your doctor or a specialist like myself, or there's a plethora of information out there, but kind of seeking out the ones that are the reliable ones.
Let's shift gears a little bit. So, you are a woman of color in academic medicine. How have you navigated this?
So our class had a lot of women of color. We actually had three, which is a lot for residency classes to OBGYN, considering many classes would have one or not. I was on the elevator with one of my other co-residents, and the elevator opened, and one of our attendings, or the people who are already fully trained, this man, he looks at us, he said, "Ah, there are two of you." Partially shocked, partially, oh, haha, it's an old boys club. We know how it is. We laughed it off. But looking back and seeing the amount of times people didn't even care to know my name, they would call me one of my other co-residents' names so frequently, regardless of how much of a big case we had that, was something substantial. I remember I had a professor who didn't want to write me a letter of recommendation because he thought, oh, you don't really want to do medicine, do you? Right? Like this is maybe nursing or something else. So why don't you ask someone else for your letter of recommendation, despite the fact that I did really, really well, in his class. I think when I became an attending and I'm Dr. Trotman and I'm seeing families, that's what I really understood, that many people had never seen a Black doctor in this space, to the point where I had a lot of people tell me, I have never had a Black doctor, or I've never seen a Black doctor. Or some families, when I call them in, they were almost shocked, almost, or questioning. I also appeared younger than my age. So I had a lot of families who would say, okay, you look like a teenager yourself. Like, why, are you sure you're I've literally had someone say, are you the doctor? Or after spending an hour speaking about surgery we're going to do, say, well, who's doing the surgery? Well, who would you like to do the surgery? It's me doing the surgery. Or, oh, you're Dr. Trotman? And so I started giving it back a little bit. So I became sarcastic. Oh, were you expecting someone else? Or would you like to see someone else? Or with time, my reputation now precedes me. So that became a lot less. But in the beginning, it actually was quite difficult to overcome families' perception of, well, this is a Black doctor that looks young. Could I trust her? Is she okay? Should I trust in the hands of my child? That overcame pretty quickly. And then I had the opposite thing, which I think was beautiful. When you walk into a room, you have another family of color, particularly a Black family, and they're so excited because for the first time they have a doctor who also looks like them. Or I love to wear braids, as you can see. So if I'm wearing braids, the child is wearing braids, mom is wearing braids, just having this moment of we see each other and I can see you and I see myself in you really has opened a lot of doors as well. So I tend to focus more on those.
What words of advice or encouragement you can give to others that they may, they're in a specific space, they work their butt off to be in that space. And so how do they navigate that?
This is your game that you're running. You're not here to prove your worth to anyone else because your work is going to speak for itself. So bringing your authentic self into the space, knowing that you are well trained and knowledgeable, otherwise you wouldn't be there. It's too hard to graduate medical school, graduate residency, become an attending, do fellowship without being excellent with us. You almost want to have blinders on and making sure that you're not trying to cater to everyone too much. It's going to happen and you can't take that home either. You can't use other people's impression of you that's not true to basically build motivation. You build motivation by what you have your eyes on.
Thanks.
And also leave the space. It's okay to leave.
Keep your peace.
I am the proponent of leaving spaces that don't serve you because guess what? There is a space that will serve you.
Now, talk to me about your new. You've started something new, or it's been around for a little bit. So tell us a little bit about your. Yeah, tell us.
I have this new health education venture called Eva Afia. Afia is a Swahili name for well-being. And this really came out of the fact that we have so much terrible morbidity, meaning sicknesses within women, particularly Black women. And we're targeting 30, 40, 50-year-olds when we should be targeting children and adolescents who still have an opportunity to make changes in their health and also give people the information. So people go to the doctor, they leave the doctor's office, they have no idea what was said. They don't feel the ability to ask questions. They don't feel, or they're not hearing the information in the way that they can understand it. So my goal, just like I do when I'm in the office, is to give people bite-sized information, really make it at the level where people could understand, so that way they can then make an informed decision. My job is not here to tell you, you must do this. My job is to give you the information, because what we found is if you knew the options and the information, you may have made a different decision for yourself or your child. So Everthea is going to be a platform where I can't get to all the people. Oh, I would love to see everyone and have fun all day in my office. I could only see so many people in a day. So why not have a platform where regardless of where someone is in the country or in the world, they can go onto my website and see information on things from something as small as, is this vaginal discharge okay, to really the bigger things is my child's menstrual period okay? Should I be worried? If I am worried, what can I do about it? And where can I seek out resources? So right now I'm working on a mental health toolkit. And what that toolkit is going to basically bring the first medical visit home. So you're going to have the information before the period starts. Let's get ready. So this is just one of the first things that I'm doing to say, okay, not everyone can see us in the office. They just can't get to us for a number of barriers. So I really want to take that to the population, to the community. They can use that. And then with that, they can better gauge what's my next step. The goal eventually is to build Everafia into a full scope patient navigation. So, let's say someone goes to the doctor, they understood some of it, but not quite. We would really sit in between and say, okay, this is what happened. Let's explain this for you in layman's terms. So can we be that lay ground between what happened in the office and what you should do?
I can't wait. I can't wait to look back at this in a couple of months, years, and see how this has grown. If you can talk to the younger version of yourself when you're just starting out in school, what would you tell her?
Honestly, I would say you are good enough. You are worthy. Just relax. I think I put a lot of stress and pressure on myself unnecessarily because I do vibrate in this sort of excellence. Not everything has to be prime and pristine. Some things you can take easy and enjoy the ride. So relax and enjoy the ride just a little bit more because it's okay.
I love that. Dr. Trotman, Jill,
Yeah.
thanks for joining us today. It was an amazing show, and I'm excited to see what you're going to be building, and you're just getting started. So happy that we can support you. Y'all make sure you check out the website when it launches.